71745, and this is my partner.
Hi, my name is Sofia Nisa. My matrix number is 0695991. So today we're going to talk about lymphedema and mastectomy. Let's go!
A mastectomy is surgery to remove all breast tissue from a breast. It is most often done to treat or prevent breast cancer. Lymphedema refers to tissue swelling caused by an accumulation of protein-rich fluid that usually drains through the body's lymphatic system.
There are two types of lymphedema, which is the primary and secondary. The primary is caused by malformation of the lymph vessel, while the secondary is caused by damage like surgery, trauma, or radiation therapy. The next one is the causes of primary and secondary. Primary is caused when congenital, and it is caused by Mage disease, while the secondary is caused by surgery, and the most common is the mastectomy.
These are all the symptoms. The most common symptoms are swelling, fullness, aching, and weakness. For the diagnosis, it involves MRI scan, which is helping to produce high-resolution images of the involved tissue, CT scan to help reveal blockages in the lymphatic system, ultrasound to help find obstruction within lymphatic system, lastly lymphography help to find the blockages by the highlighted of the dye injected.
Moving on to doctor management. The first management is liposuction. This is to remove extra fat caused by lymphedema. Next is the lymphatic-venous anastomosis, which is a removal of lymphatic tissue. The third one is the vascularized lymph node transfer. It is a less common process that involves transplant the normal lymph tissue with the abnormal ones. And the last one is the skin graft. It is a process that is when the affected tissue will be removed and other skin area will be taken as a repair purpose. Next is physiotherapist assessment. This involves observation, girth measurement, and palpation. Firstly, for observation, physiotherapy will check the wounds or scars appearance if it exists. Secondly, the girth measurement of both limbs, left and right, will be taken during few sessions. This will help to evaluate or see the patient lymphedema severity. The last one is palpation. It is including pitting, which is the skin depression persists only for seconds. Then the brawny. It is when the pressure feels harder when palpation. And the last one is the weeping, which is there will be a fluid leaking during palpation. For girth measurement, the first step is to look for acromion process. After that, I will measure 5 cm from acromion process inferiorly and mark to the 5 cm after. This marking process will be continued until 20 cm from the acromion process. It means there will be 5 cm, 10 cm, 15 cm, and 20 cm from the acromion process. Proceed to the elbow level. The first step is to find the olecranon process. For point markers, it is same as before, which is 5 cm, 10 cm, 15 cm, and 20 cm from the olecranon process. Don't forget to also take the standard process, which is the wrist line and MCP line during the measurement. taking the girth, the severity can be determined. For example, if the girth is increasing greater than 5 cm, it shows that the lymphoedema is getting severe. So, this is one of the example of the girth measurement data sheet. Then, this is some pictures to help you understand about types of edema when doing palpation. Finally, the physiotherapy management. The first one is manual lymphatic drainage or MLD. It helps to clear the lymph flow and reduce the swollen area. Just imagine that this person affected side is at left side. First, we start with scooping technique by clasping both hands together. Patient will push and scooping fluid towards belly button, above hips 5 to 7 times and below hip 5 to 7 times simultaneously. Then, put the hands at center of the belly while give a little pressure. Continue with 10 deep breaths into the nose and out through the mouth. Next is the neck area. We will only use 2 fingers and we need to find a hollow space above the collarbone. Stretch the skin ups and down slowly 5 to 7 times. Then move to the affected side afterwards. Do this technique 5 to 7 times under the arm. Move to the above breast and bring it along the way to the healthy side. For the shoulder, we need to push fluid from the back of the shoulder and we can cross it to the chest and cross to the healthy side. Make sure to use your palm smoothly and do this technique 5 to 7 times. For the elbow, we need to push fluid from the inside to the outside of the hand 5 to 7 times and push the fluid over and pulling it back up. For the forearm, it will use the same principle, which is stationary circle, stretch the skin and let it go back. This will be repeated 5 to 7 times as it will help to promote the lymph flow out of the swollen area. Lastly, we can focus at the wrist area. Second is therapeutic exercises such as lymphatic drainage exercise or LDE or circulatory exercise that will help to improve lymph flow or lymph circulation.
Before doing the lymphatic drainage exercise, instruct patient to do deep abdominal breathing before and after the treatment. Instruct the patient to turn their head to the side, back to the middle, and to other side as much as possible. Next is ear to shoulder. Shoulder has to be relaxed and the body must be straight. Next one, shoulder exercise. Rotate shoulder as much as possible. Up, back and down. Backwards and then forward. Now for the combined movements, instruct patient to start on knee, then touching the shoulder and up, going back to the shoulder and to the knee. Another combination of movement will be pretend swimming. Start with breaststroke. If it's painful, instruct patient to do it lower. Next one will be backstroke. Next one, wrist exercise. Instruct the patient to lift young or arm on an armchair or a table. Let the wrist go as much as possible and down as much as possible, bending the fingers only by knuckles, and then touching thumb with each finger.
These are some examples for lymphatic drainage exercise. First one is ball squeeze exercise. This exercise would need the patient to grasp exercise ball lightly while extending their arm to the front higher than heart level. Then they will start squeezing the ball, hold for 3 seconds and release. Second one is elbow flex seated exercise. This exercise would need the patient to slowly bend their elbows with breathing in, hold the position for 3 seconds and relax. Patient position for both exercise is in sitting and it will be repeated 5 times slowly and gently.
Third one is bandage and compression. It helps to increase interstitial pressure and increase efficacy of muscle and joint pumping. Lastly is patient education. This consists of prevention and lifestyle modification to make sure the risk of hurting more the affected area is reduced. For example, patients need to be more cautious when cutting nails as it may cut the skin and they may get infection easily.